Bentrovate e bentrovati alla seconda puntata di Psychedelic Sessions. Io sono Daniele Damiani, psicologo psicoterapeuta, consigliere della Società Italiana di Medicina Psichedelica e attualmente al mio secondo anno di formazione in psicoterapia assistita da psichedelici presso la Mind Foundation di Berlino. Sono principalmente interessato agli apporti clinici che l'approccio psichedelico potenzialmente può offrire alla pratica e alla loro implementazione, sempre all'interno, va da sé, dei confini etici, legali e professionali. Preferisco usare il termine approccio psichedelico e non sostanze psichedeliche, da una parte per includere stati psichedelici non derivati dall'assunzione di sostanze, dall'altra per evidenziare, già nella scelta del termine, approccio, che non si tratta solo di un nuovo strumento farmacologico o terapeutico, ma potenzialmente di un qualcosa che ha in sé un elevato potere di cambiamento, di messa in discussione, di disruption di sistemi teorici, clinici a svariati livelli. L'intento di questa serie è quello di divulgare conoscenze e informazioni corrette, riferite appunto all'approccio psichedelico, alla salute mentale e alla terapia. In questa puntata si parlerà di ADHD, con particolare focus sull'adulto, cercando di offrirne una descrizione comprensibile della sintomatologia e di alcuni meccanismi neurali interessati. Le attuali indicazioni terapeutiche per la DHD prevedono l'impiego di farmaci stimolanti e di terapia cognitivo-comportamentale. Tuttavia, ci sono diversi dati disponibili in letteratura che riportano un basso grado di compliance, di aderenza verso la terapia farmacologica nell'adulto, cioè o per gli effetti collaterali o per questioni di efficacia, le persone tendono a non assumere la terapia come dovrebbero. Altri dati, sempre qualitativi, da self-reports, ci parlano dei possibili benefici sulla sintomatologia che derivano dall'assumere microdosaggi di psichedelici, il cosiddetto microdosing. Quindi, spinto dalla voglia di approfondire, ho contattato una ricercatrice che si è occupata di questo argomento e che ha gentilmente accettato di fare questa intervista. Nella prossima ora, quindi, parleremo di ADHD e microdosing con la dottoressa Totomanova, ricercatrice che combina approcci di neuroscienze, psicologia e farmacologia. La sua ricerca si concentra principalmente sulla DHD e spera di portare maggiore consapevolezza sull'uso terapeutico degli psichedelici. La dottoressa Totomanova ha conseguito un master presso l'Università di Maastricht, dove presto inizierà il dottorato sotto la supervisione di Kim Kuipers, ed entrando quindi a far parte di un gruppo di ricerca che è molto vivo e prolifico. L'intervista si svolgerà in inglese. Auguro a tutti e a tutte buona visione. Hello, Hiba. Really glad to have you here. And I'm happy to have you here in this particular day for you that you have just received a great news, one that you were waiting for for a long time.
Yeah, of course. Yeah, very happy to be here. First of all, thank you for inviting me to this podcast. And yeah, definitely. Recently, we learned when applying for grants to continue researching ADHD, microdosing for ADHD, and we recently learned that we got a grant that we applied for. So that means that I could start my PhD on this topic in January. Just in general, we can continue researching this topic, which is really, really exciting for me. And yeah, we've been preparing this and waiting for this for a very long time. So we're all very happy that we finally got it and we can support our research in the future.
Yeah, I'm really happy to hear that. And I'm sure there are going to be great insights about the ADHD and microdosing psychedelics, that it's a field with a lot of good perspective and nice also therapeutic insights. We're going to have a closer look at it in this podcast. But first, maybe it's a good thing to speak a little about ADHD in itself. We usually speak about that disorder, usually related to children, because it's something that actually starts in childhood, neurodevelopmental issue. But there are also people that had never been diagnosed during childhood that still have ADHD in their adulthood with different characteristics because the disorder change through life cycle. So I would like you to maybe speak about the ADHD by your perspective, that is a perspective of a neuroscientist.
Yeah, before diving into the brain areas and how that is connected to ADHD, I thought of having just a more of it with some basic facts. So I prepared this infographic that I'm going to put on the screen now that just summarizes basic information about what is ADHD. Right? So starting with the definition, as you said, it is a neurodevelopmental disorder that starts in childhood and can progress in adulthood as well, and can sometimes significantly interfere with everyday life. As you rightfully noted, neurodevelopmental is important here because it reflects a different developmental trajectory of the brain throughout the life. So in this sense, it's not a mental illness per se, as in the sense that you're not in a state of mind that's different than your normal state of mind. You are in your normal state of mind. It's just this is different than the neurotypical majority. So it reflects the natural differences between people and between brains. And even though it starts in childhood, it progresses into adulthood. It's a chronic and lifelong disorder, and more than half of the diagnosed children still have symptoms present later in life. So that amounts to about 2.6% of adults worldwide being diagnosed with ADHD, or around 3% if you look at different sources. This one was
A
calculated
lot of people then.
Yeah, that's around 140 million people worldwide. That is, quite a lot. But yeah, worldwide is about around 3% prevalence of adults. And um, the core symptoms of ADHD can be summarized in two main domains. So the inattention domain and the hyperactivity impulsivity domain. So inattention can include symptoms like having difficulties focusing your attention on a task or maintaining it on this task, being easily distracted or mind wandering, so being in your thoughts a lot, having difficulty organizing yourself or your surroundings or your work, and having difficulty planning or making decisions. And hyperactivity can manifest itself, of course, as hyperactivity, so being running or climbing or having difficulty staying in one place or staying seated, fidgeting with your hands or your feet or another body part, your tongue, for instance, excessive talking, that can also be a sign of hyperactivity, or interrupting others frequently, and being impulsive, making impulsive decisions, not being able to think so much about the consequences of reactions in the future, or having emotional impulses, right? And again, these are the main symptom domains, but as you also noted, they don't adequately account for the full extent of the functional impairments that we see throughout the lifespan. So in adults, they change a little bit, the symptoms. So for instance, this motor hyperactivity is not that common in adults as it is in children, because the brain areas associated with it kind of normalize with age. So this deficit also normalizes, but adults also have different problems, so different symptoms that are not within those main domains. For instance, up to 70% of adults with ADHD also have problems with emotional regulation and some mood disturbances. That can manifest as depressive symptoms or anxiety symptoms or problems socializing. And of course, these symptoms are also important to be addressed, but currently pharmacological treatments focus on mainly these two main domains of symptoms that I told you about. And they don't adequately address these kind of extra symptoms. So we need alternative medications, especially for this subpopulation, right? Because it's important to improve their quality of life, of course.
Okay, so thank you. That was really a clear overview of the complexity of the ADHD universe. The last point that you made, it's that, and we were discussing it before starting this interview, that what it's seen comorbidity, like mood disorder, like anxiety disorders, they were treated like different things that just get along with ADHD. And now we are more inclined to think that they are part of the disorder itself.
Yeah,
So,
definitely. We are beginning to appreciate that ADHD is a much more heterogeneous disorder than we thought, and there are many different subtypes of that, and different people have different symptoms or struggle with different things, and that's also reflected in their biology as well, and are helped by different treatments. So it only makes sense, right, to have different treatments for these different subtypes, right? It's
okay.
different to think of it as an anxiety syndrome, different from the ADHD, and as something that is emotional dysregulation or difficulties with regulating emotion that comes from this ADHD, of just more general syndrome of having difficulties regulating also your cognition in emotions, right? And this is a different way of approaching the treatment than just for an anxious person who has generalized anxiety disorder, for instance.
Yeah.
So it's a different approach, and it's important to recognize that so that people can get the treatment that they need.
Okay. So, why psychedelics are or could be important for ADHD?
Yeah, that is a loaded question. Yeah, we will
I
discuss
can I
that.
can rephrase that.
Yeah. You can make it a bit more specific, maybe.
I stumbled upon your bachelor thesis like 2 years ago, where I was researching if anything was research or written about psychedelic and ADHD, because I thought that cognition also is something that's really, really modified and could be also disrupted by psychedelics. So, since ADHD has also a lot of cognitive particularities, cognitive aspects, letting alone the mood and the anxiety aspect, but also cognitive. I was trying to find if something was written about it, and I stumbled upon your bachelor thesis. It was actually the first results on Google, and that's why also I contacted you. I don't know if you want to speak for a moment. What actually make you want to research the particular field?
Yeah, I can start with the history behind it, I guess, how I got into this, which is connected to my bachelor's thesis, yes. Well, I've always been interested in the mind, the brain, especially how that is changed in pathology or in mental disorders, and how we can affect that with substances, with pharmacological substances. So I always knew that I wanted to do something in this direction. And the psychedelics being so very powerful and having this enormous potential for transforming behavior, cognition, emotion. I was really interested in those and exploring them further, how those can, what effects do they have on the brain actually. And so when I was doing my bachelor's thesis, that was 2020, so exactly when COVID started. So as I was writing it, I had to change my topic. I had to do a literature review. I couldn't go to the lab anymore. And so my supervisor said, yeah, well, then you can do it on whatever topic you want. And I, of course, did it on psychedelics. This is what I was fascinated with. And I did it on ADHD, psychedelics for ADHD. There was nothing for this at that time. There was some psychedelic research, but it was mostly focused on mood, on emotions, on depression, anxiety, and I wanted something with cognition. That's what I was interested in. And ADHD in itself was really interesting to me personally because I still have a lot of friends who have ADHD or think they do, and I also thought I did, and now I know for sure I do. I've been diagnosed now. So that was all just very interesting. It kind of fell into place. Yes, I really tried to make to argument for it and really dive deep because it was the first official paper that I could write on this topic. So I was really excited. So I wanted to dive deep into this. And yeah, I kind of tried to make the argument for it and look at the brain areas that they affect and search for a match between that. And then I ultimately proposed microdosing, right, as a potentially beneficial and safe way to perhaps address this. But again, that was really, really in its infancy back then. There was no research on this. I'm really happy now that I got to work as an intern on the first ever clinical trial in Maastricht for microdosing for ADHD. That was really nice. And now I get to do my PhD also in this topic, which feels really, really nice. Yeah, to just be in the developments of this field as it is developing.
So, there for the 4 years had passed, and now we can say we have a little more evidence about the ADHD brain under psychedelics, under microdosing and also macrodosing. maybe more microdosing, right? And I think it could be interesting to just because in your thesis you made a nice comparison between the effects of psychedelics and the functioning of ADHD brain. So I think that could be really interesting if you can speak a little about that.
Yes, yes, of course, of course. I have a little brain graphic here to make it easier to follow what I'm saying. Yeah, all of the symptoms that I mentioned before basically stem from different deficits in the brain that we see, both structural and functional, and they affect various brain regions. We talked about heterogeneity, of course, so they affect various brain regions. They can affect those. Some of these are illustrated here. These are kind of like the main ones that are involved in ADHD. For instance, the frontal region, so the prefrontal cortex, you can see here in purple, and the anterior cingulate cortex in pink next to it, the ACC. Those frontal regions are very important because they, especially the prefrontal cortex, they deal with executive functioning. So executive control of cognition, emotion, behavior. So that's functions like organizing, planning, decision making, inhibiting irrelevant responses to distractors or also to emotional impulses, control of attention, especially top down control of attention. So, paying attention when you don't necessarily want to. The stimulus is not necessarily salient, but you know that you have to. So, for instance, when you study, so you need to make yourself pay attention. Specifically, the ACC is very important here because that kind of facilitates the switching to conscious paying of attention when you want to focus on a task like studying. So this facilitates the switch to work mode, let's say. And as you already know, I already mentioned that people with ADHD have difficulties in a lot of these functions that I just mentioned, that these brain regions are responsible for, these executive functions, right? And we do see in ADHD that these regions have abnormalities. They usually have less activation than normal. So that means that they're less able to exert their control over behavior, over cognition and emotion, and perform all of these functions. And they also have less connections to other brain regions that help them, right, to exert all of these functions. And they also have some structural deficits, right, that psychedelics might be able to correct, let's
Okay.
say, with long-term use. Yeah, and in order to exert all of these executive functioning and control over all of these functions, of course, they need to have connections to other brain areas that are responsible for these functions, right? They form functional networks. For instance, here, the basal ganglia that we see in blue here, I labeled the most important areas, the caudate nucleus and the globus pallidus. But this is basically a collection of a lot of different brain regions, and it's mostly involved in controlling motor behavior and motor cognition. So in ADHD, we know they have a smaller volume, so that gives rise to these hyperactivity symptoms. However, we know that in a lot of people, this smaller volume is able to normalize with age. So in adults, we don't see that many hyperactivity symptoms, for instance. That is because of these brain regions. But these brain regions also have functions in other things like reward or learning, which is also very important for ADHD. They have a lot of dopamine neurons there, and dopamine is very important for ADHD. It's responsible for motivation, learning, goal-directed behavior, right, which is something people with ADHD struggle with. And here, people with ADHD have lower dopamine activation in these areas, lower dopamine, and that basically can contribute to their inability to predict when events are going to occur or when rewards are going to occur. So that can contribute to their difficulty in learning. Usually,
Yes.
what happens is that, let's say you study for a test and then you get a good grade, right? So then over time, you start associating studying with dopamine, right? Because getting a good grade makes you have a dopamine rush, right? The dopamine spikes. So over time, that's how you learn that studying is good. It makes you feel good. It's good for you, right? You learn this habit. But this process is, you need dopamine for this, right? But this process is altered in people with ADHD. So they cannot transfer this dopamine spike to the stimulus itself, studying. So then it's hard for them to expect rewards in the future. They want immediate gratification. right? So it's hard for them to have motivation, for instance, or to learn with rewards in this case. So this is something that can occur from these basal ganglia regions. But
But this
also,
is also something that is not just seen in ADHD. No, it's also seen in a different disorder like addiction disorders and
yeah, no, definitely, definitely. This is called the dopamine transfer deficit theory. It's definitely applicable in a lot of different contexts. And this is also, it's important to say, this is also one of the possible explanations of dopamine deficits in ADHD. There are other theories about how dopamine might be involved and how exactly these difficulties might occur because of dopamine. Yeah, but I think this is one of the subscribed theories. That's why I'm explaining
okay.
that one. There are also, I mean, other connections to these. I mentioned the emotional regulation. This is caused by this little small tiny region here. Maybe you can see the amygdala. This is part of the limbic system involved in emotional processing, emotional impulses. And in ADHD, it's overactive. Usually the frontal areas inhibit this area, inhibit the emotional impulses coming from there. But in ADHD, there are less connections between this area, the amygdala, and the frontal regions. So that leads to it being overactive. Right. So there's no, so that can lead to impulsivity, deficits in emotional processing, right? And no emotional stability. And the cerebellum as well, which is the orange part here, which is involved in timing, temporal processing, and that is also proposed to be one of the key deficits in ADHD, or at least a subtype of ADHD, temporal processing. We can see that, of course, in connect to reward, right? Not being able to predict when the reward is going to come. We talked about that. Also with impulsivity, organization planning. So not being able to predict your consequences of your behavior in the future, for instance, or just playing with estimation of time intervals. So the theory is that the internal clock of people with ADHD is faster, right? So overestimate the time that it will take you to complete a task. For instance, it's just everything is happening very quickly. Psychedelics, or what we know from psychedelic research until now, actually seems kind of promising that they might have effects on these brain areas, and in this way they might ameliorate some of these symptoms. For instance, with the cerebellum, I think one of the most consistently found results in microdosing studies is their effects on time and temporal processing. That there's even in microdoses, there are significant changes in your time perception. And not only that, but these changes are in the opposite direction. So time is slowing down, it stretches out, right? So perhaps it might be a way to sync up, your internal clock with the world around you in this way. This is again really in its infancy, and this study is done on neurotypical people, not ADHD people. So of course it might differ the exact effects, but still it is quite promising that it can address this symptom that is usually overlooked.
Sorry, I just interrupt you because the time aspect and this slowing of time and the internal clock of the ADHD brain, it is not so easily grasped. Can you give an example of different way of perceiving time, the internal time of ADHD?
Yeah, I mean, this is also a new development, let's say, in ADHD theory. Well, relatively new. It's been proposed as like a new subtype, one of the three main, let's say, brain pathways or that involved in ADHD that also give rise to symptoms, right? One of them is this frontocerebellar network that is involved in timing. And still we are trying to figure out exactly how it plays, but I think it plays a much bigger role than we think. For instance, I gave some examples like timing in a sense of not being able to predict that a reward is going to occur after a certain thing, right? Or overestimating or underestimating the time it takes for this reward to come, right? Usually overestimating. So this can have an implication on, learn with rewards, the operational learning. It can also be in terms of impulsivity, right? If you are not able to predict in the future, how your actions are going to have consequences in the future, right? That can lead to more impulsive behaviors or can be connected to impulsivity. Or it can also make it more difficult for you to plan for the future, to organize yourself, to make decisions as well. So again, this is one component, right? It's not the one that is maybe necessarily responsible for it this directly, but is one component that is also seen in the ADHD brain that also can have an effect, contribute to these symptoms and the way you experience these symptoms.
Okay, a person with ADHD is gonna, for example, underestimate the amount of time that it's gonna take for him or for her to do a task, or overestimate. Because I'm interested in about the inner clock. So how the person perceive the time. It is faster, so it means that he think they can do a lot of things in a short period of time, and actually it is not the case, or it's slower, and it means that it are gonna overestimate the time that it's gonna take to do a task.
Yeah, well, the theory is that it's faster. So everything is happening quickly, right? So there's so many things in your head, let's say, happening, a lot of parallel thoughts. So
Okay.
your internal clock is faster, right? So then you can't really kind of sync up to the world around you, let's say. That is
All
also, I
right.
think, maybe connected to sometimes a symptom of ADHD is said to be not being able to relax. Like in a lot of these ADHD questionnaires, there's or symptom questionnaires, there's a question, are you able to relax? So I think that also might be connected to this of your internal clock always being really quick and not being able to kind of, yeah, sync up with what is happening around you.
Okay. That it's strikingly similar, of course, in a different way, and I don't suggest anything than a speculation, but also in hypomanic manic states, in certain mood disorder like bipolar 2 and bipolar 3, the sense of time, it's actually speeding. The speed of thoughts, a lot of thoughts come in rushing to your head and you can't actually grasp them, so you are being flooded by these thoughts. That, of course, it's a totally different experience, I think, having an hypomanic state than having ADHD time perception. Can maybe be based under similar neural structures. It's just an hypothesis.
It might be, yeah. I am not completely sure what particular brain structures exactly are involved in bipolar, but if it has something to do with the cerebellum or the frontocerebellar pathways, then yeah, it might also have something to do with this temporal processing. The cerebellum in general is involved in the organization of behavior and the planning of behavior. So for instance, if you want to start walking, of course, your motor cortex is responsible for this, but for the start and the stop, the cerebellum, so the coordination of this, right? The
Fine
planning kind
movements.
of in this, the planning, the organizational coordination of behavior. And
Yeah.
in that sense, temporal processing and timing, right? So also connected to behavior, hyperactivity, for instance.
Okay, thank you for the insight about that. But we spoke about mainly dopamine as a neurotransmitter, but there are other neurotransmitters involved in ADHD, because of course in psychedelic we know that it depends which psychedelic, but the classical psychedelics, they're known to be mainly their main effort is on serotonin reception receptors.
I just wanted to say that before we move into neurotransmitter, I also want to say a bit more about the brain and like specifically how psychedelics affect these brain areas that I just
Yeah,
mentioned. Quickly do that. But
of course.
yeah, um,
Please.
I'm yeah, I mentioned the cerebellum briefly, right? But we also have some evidence about the other brain areas being affected in a positive way, perhaps by psychedelics. So, for instance, we know that I mentioned that the frontal areas are underactive, right? But we know psychedelics are able to increase the activity there. And not only this, but also they can increase the connectivity between these frontal regions and all the other regions that I mentioned. So that again makes it easier for these frontal areas to do their job basically, and to exert their functions and exert executive control over these other areas and functioning. And specifically, for instance, the amygdala, I mentioned it's a bit overactive because it has not a lot of connections. We know from microdosing studies, which is also really exciting, that microdoses themselves do that they increase this connectivity of the amygdala with frontal regions, other regions as well, but for our purposes with frontal regions as well, and that corrects this overactivity of the amygdala. So then that improves emotion regulation, basically, which is things like that. And also connected to dopamine as well. As I mentioned, there's like lower levels of dopamine specifically in this basal ganglia and frontal areas. And even though psychedelics don't directly affect dopamine, we know that through their action of serotonin receptors, they also increase levels of dopamine in the brain, and specifically in the basal ganglia and prefrontal cortex. So they kind of correct this altered reward sensitivity and can help with learning and motivation as well. And to build on this a bit and answer your previous question, dopamine, yes, is involved. I mentioned that already. It's very important for ADHD, but also norepinephrine is also very important for the disorder. Dopamine is mostly involved in, as I said, learning, reward, goal-directed behavior, motivation, while norepinephrine is more responsible for like a arousal of the brain, arousal state of the brain. And also it is thought to be the main fault for difficulties with attention that we see in ADHD. So people with ADHD have lower levels of these two neurotransmitters, and psychedelics have been shown to be able to increase these levels, not directly, but through their action on serotonin receptors. So also psilocybin, we know, increases norepinephrine levels, so that can also kind of correct this.
This imbalance.
Yeah, exactly.
Yeah. Okay. So you showed this beautiful image of the brain and of the systems, the regions that are affected by ADHD, and also gave us some insights about how psychedelic can restore a balance in these regions. But there are other regions or functional networks that are thought to be deeply involved in the.
Yeah, definitely. I mean, this is, as I said, it's much more complex than this, right? It's also heterogeneous. So some people might have deficits in some brain areas and others in other brain areas. It's not necessarily all the same, right? For every individual. This is what I just described was kind of like the main executive function networks in the brain of just the frontal regions and their connections. So there's kind of the main symptom domains in ADHD, or the main functions that are affected in ADHD. But of course, there are others, yes.
One of the most cited functional network in the brain in psychedelic research paper is the default mode network. And is that you can say about default mode network and also ADHD?
Yeah, definitely. So the default mode network is, again, a network that comprises of a lot of brain regions, not just one area. Here I highlighted some of them, like for our purposes, the prefrontal cortex, or regions of the prefrontal cortex, and this posterior cingulate cortex, PCC. And it's mainly involved in doing nothing. It's most active when you are at rest, when you're doing nothing, when you're not engaged with your surroundings, you are not focused, you are in your thoughts, perhaps reflecting on things in the past, perhaps planning things in the future, perhaps being in the present, but you're just focused inwards, right? Mind wandering. And usually stop relaxing and start working on something. When the activity in this brain network goes down, and the activity in another brain network called task positive network, which is just responsible for focused attention, that increases. So then you're able to focus on what you would like to do on your work, for instance. But in people with ADHD, this switch, and so the default mode network is overactive. So when you want to start focusing on something, the task positive network does increase its activity, but the default mode network does not decrease its activity. So both of them are active at the same time. So then it's really difficult while you're focusing, you have already like you're distracted. So as you can imagine, that can lead to a lot of distractibility
Yeah.
and just make it very frustrating for you to do your, not only this, but this the default network is also connected to ruminating thoughts, so that can also lead to emotional instability. So if you get stuck in one thought over and over again, you're ruminating over it, obsessing over it, right? And psychedelics have been shown to reduce the activity in default network, specifically in this PCC area, to reduce the activity there. So that reduces also mind wandering, distractibility, ruminating thoughts, right? And you can more easily then switch to the other network and focus on your task. There's this, we talked about this paper briefly with you before we started, but there's new paper, recent paper, that is really exciting, that found that high doses of psilocybin are able to disrupt, reduce functional connectivity, especially in the default mode network regions. So between these hippocampus, anterior hippocampus, and default mode network, which is associated with therapeutic effects in general, specifically for depression. We talked about the ruminating thoughts, for instance, right? But also can be applicable for ADHD. And what is, I think, more interesting in this paper is they compared that to methylphenidate as their placebo. They used that, and they saw that psilocybin's effects on this were almost 3 times larger than that of methylphenidate. So this in itself is also really exciting result, because it also shows the promise, of psychedelics, that they can have therapeutic effects, and they might even have more profound, or let's say deeper, therapeutic effects than conventional medication.
Yeah, the study that you're referring to, it's a new study that's just I think 1 month old. It's called Psilocybin Desynchronizes the Human Brain by Siegel and others. You will see the link in the description. These results are also interesting because the effect, it was measured during maybe 1 or 2 weeks after the dosing session. So it is really important that we can see the immediate effect of the psychedelic. But of course, to be an elective treatment for disorders or neurodivergencies, or I mean, to just be able to balance some imbalanced brain system, they need to have also a long-term effect. And there are evidences that this could actually be the case of psychedelics, also with microdosing.
Yeah, definitely. Thinking about this, what comes to mind is there are some studies on microdosing's effects on BDNF, brain-derived neurotrophic factor, which is just a neurotrophin that is involved in brain, like neuronal maturation, development, synaptic plasticity, synaptic transmission. So it has effects in learning, of course, but also it's just very important for a general therapeutic effect. So low levels of BDNF are seen in a lot of disorders, and a lot of treatments increase levels of BDNF, and that's just very important for a therapeutic response in general. And we know that psychedelics microdoses, one single dose of one single microdose is able to increase BDNF levels for up to 2 weeks after this dose. At least 2 weeks after was the last point measured. So again, as you also mentioned, these long-term changes are very important for a therapeutic effect, definitely, and for it to be used as a alternative treatment. And we can see that, for instance, with this disruption in functional connectivity, with this increase in BDNF, with perhaps the structural differences that certain brain areas, right? Those are more long-term changes that can lead to more persistent therapeutic effects.
Okay, yeah, all right. Okay, so we are going now deep in the matter of research and evidence from research. Of course, when we speak about psychedelics, we have a lot of naturalistic studies, so retrospective studies that are not so, say, they're not considered so in
Say something like
exactly
rigorous.
by the scientific paradigm that we are into, and but of course they give us a lot of data. So can you speak about 2 or 3 of these naturalistic studies that the data they gave us can also be really, really helpful to inform more rigorous studies. So it could be just a starting point to also think and imagine also different ways of doing a rigorous scientific trial that can take into consideration the peculiarity of the subject. But if there are there some naturalistic studies that you consider interesting in this method?
Definitely. I mean, when talking about microdosing studies, there are relatively few microdosing studies, studies on microdosing. So just I think it's important to say that relatively we know about this, right? So we're still in the beginning of trying to understand what microdosing is, right? And within those studies, there are very few studies that actually recruit ADHD individuals, and most are just done on neurotypical populations, right? However, in a lot of these naturalistic survey studies, just a big portion of the population of the sample turns out to be people with ADHD who microdose to relieve their symptoms, right? So that just already shows us there's a large proportion of people with ADHD who self-medicate with microdosing, right? And not only this, but they also report that they experience similar efficacy of these microdoses to their stimulant medications. So again, this is a very big claim, right? So just a few quotes from some of these studies that I took out that I think are really interesting and kind of showcase the patient perspective of this, of how they experience microdosing connected to their ADHD symptoms. And I think it's really insightful as well. So for instance, all of these are from survey studies, right? These are quotes from participants in these survey studies. So there's the first one that says, I've been taking medication daily for the past 10 years for ADHD. I always had an issue with concentrating, but microdosing let me get into that flow state and get all my work done in one sitting. And then another one says, Adderall has this feeling of like forcing you to focus, whereas LSD, it's more like you want to, right? So already we can see, that showcases that it can be as effective and as safe as conventional medication, and that's how people perceive it as. And not only participants, but there's this quote from James Fadiman, who is a legend in the microdosing research, the father of microdosing research, he's called
Yes,
sometimes.
basically.
Yes.
Yeah.
Yeah, he started this whole thing, exactly. And that's a quote from an interview he had with the Rolling Stone, where he said that that microdosing might be an extremely healthy alternative to Adderall. Now, when he said that, that was in 2015, there was no microdosing for ADHD research. But so the concept he said it in was that he envisioned healthy people who don't have any deficits or learning deficits, right? But who want to boost their cognition, boost their productivity, for instance, studying for a test, and then they take. So he said, well, if you want to do that, it's way more safe to take a microdose. So even if he's not envisioning ADHD patients, still it showcases the possible safety of microdoses compared to conventional medication. Unfortunately, there are not a lot of studies done on ADHD population, as I said. There are only two. Both of them done by Eline Hayen, who is my colleague from Maastricht University. I had the pleasure to work with her during my internship, and now I will have the pleasure to continue working with her during my PhD. So she did the first ever, basically, naturalistic survey study recruiting people with ADHD who microdose on their own initiative. So they procured their doses and they microdose on their own. And then she measured their symptoms, ADHD symptoms, and their well-being at baseline, at 2 weeks after microdosing, and at 4 weeks after microdosing. What's also interesting is she also added another group in this study that also have ADHD, and they don't microdose, but they just take their conventional medication. So then she wanted to do a comparison between microdosing and conventional medication. And the results are very promising. She found that microdosing was effective in improving ADHD symptoms, and at the 2-week time point, ADHD symptoms decreased significantly, and at the 4-week time point, they decreased even more. And at 4 weeks, they were lower in the microdosing group than in the group that had used their conventional medication.
Okay.
Which is
But when
huge.
this is amazing, and it's a really good, promising starting point. But of course, as you said, it is a starting point. We can't say that these substances, psychedelics, and maybe different psychedelic work different ways that we still don't know. And you also said a really, really important thing. What is a microdose? Because the psychedelic community is also discussing this matter for a lot of time, and so they are just setting the different levels and infra levels, or microdosing, mini dosing, and it's a really huge confusion. And other thing that actually get this confusion worse is that in naturalistic studies, we actually don't know the amount of substance people take and also what kind of substance they take. Because you can say mushrooms, but mushrooms are a lot of different types of mushroom. If you go with synthetic psychedelics, you really can't be sure of what is in. There were some studies that actually provide microdoses to the subjects. But I don't know if there are any results out yet. And the other things about microdosing that you need to monitor the effect during time, because it's not like the macrodose that okay, you give the subjects and then you see the effects. With microdosing, you actually need to make several dosing sessions, and not just one or two, like we see in macrodosing studies. The microdosing is meant to be taken in a span of several days, and not just one. So this also added to the complexity of studying microdosing. That's really complex matters. No wonder there are not so many studies about that.
Definitely, definitely. And I think this also plays into the issue that in microdosing research in general, when you look at survey studies, questionnaire studies, self-report studies, we hear this amazing benefits, and then when you actually try to test that in the lab in control studies, the results are mixed. We don't find these amazing results that people report. And I think this has a lot to do with what you just mentioned, that we don't really know exactly what microdosing is. What dose should we test? What is a microdose, right? How can we define one dose of it? And of course, as we
Yeah.
know, the effects are dependent on the dose itself. We know from current microdosing studies that higher microdoses can sometimes have opposite effects. For instance, higher microdose can impair cognition, while a lower microdose can improve it. Or a lower microdose can improve anxiety, while a higher microdose can induce anxiety. There's a lot of, the dose itself, of course, matters. But also, as you said, how many doses you administer or when you administer these doses. Most of these studies, microdosing studies, only test one single microdose, acute administration. Of course, a few of them, but again, maybe that's not enough to see the full
That's not
effect.
how people do microdosing in the real
Exactly.
world. Yeah.
Exactly. In naturalistic survey studies where people microdose on their own, they usually do it for at least 3 or 4 weeks at a time, right? And in the lab studies, we only test one single microdose. So then, of course, that we might not be able to see the full effects, right? Especially in populations that have already some kind of deficits in these functions. Perhaps there is just more time needed for these effects to manifest, right, after
Yeah.
microdosing. Of course. And we also mentioned a bit the inter-individual variability. Of course, there are different metabolizers, for instance, for LSD. So for someone, 5 micrograms might be the perfect microdose. For someone, 15 micrograms might be the perfect microdose. Just depends on how they process the substance in their body, how they metabolize it. Not only this, but just based on your own baseline state, psychological state, that can also affect the way microdoses affect you. There's this new paper also from our lab in Maastricht that found that there is inter-individual variability in responses to microdoses. So people, for instance, had the lowest attention and lowest arousal at baseline. Those were the ones who had the most stimulating effects from the microdoses. So we see already kind of this complexity being unraveled, that we cannot just give someone a microdose and expect something to happen, but we need to be more intricate in the way we give the microdose, how often, which microdose, how exactly, and what substance. Perhaps the substance itself, the psychedelic substance itself, also matters. We don't know that much about that. But yeah, definitely, these all might be possible reasons why we have mixed results in placebo-controlled studies. And it just goes to show that we're still in the beginning of this whole thing. We don't understand this fully, and we need a lot more research to get to a point where we can say that this is helpful for this indication, for that subgroup of people, or for this symptom, or things like that.
Yeah, it looks like it's going to be a good candidate for precision medicine, individual tailoring, a way of providing treatment. But
Absolutely. And I think this is the future. It's precision medicine. So
yeah.
it's a good candidate for this, definitely. Yeah.
Of course, we are now getting deep into the biological side of things, but the organicistic way of looking at dysfunction, because there are some psychiatrists, they say personality disorder, they don't exist. It's just something that early in your brain something happened, or genetically something happened before you were born, and then you have to go with it. So they just think there is no space for the individual power of changing, the individual space for change. No, it's just deterministic. Okay, you have this, but maybe also psychedelics can change this way of looking at things, because they really powerfully insert in the biological scientific talk the self, the person, right? And that's something that also was apparent from one of the quotes that you read, that stimulants make me do things, psychedelics make me want to do things. So that's totally different way of perceiving, feeling, living. So they strongly force psychiatrists, biological psychiatrists, and to think about the personal experience. Again, what do you think about the last quotes that I mentioned?
Yeah, definitely. I mean, I think with psychedelics and with microdoses also, we see that, as you said, this immense power of the mind, of the set and setting, right, as it's called, and especially the mindset, that even in microdosing is very relevant, right? In this sense, microdoses can help you greatly to achieve your goals if you want to achieve these goals, right? They're usually thought of as non-specific amplifiers, so they amplify what already is inside your mind, right? Your mindset. So if you are in the right mindset, for instance, I recognize I have a problem, I'd like to work on this, I would like to be more aware of this, I would like to be better, then microdosing will greatly help you on this path. So definitely there's a very important and very big self component or psychological component here that can also, of course, influence, we just mentioned, the different results, let's say, that we see in the lab versus in a naturalistic setting, right? Because obviously in the lab is really different.
But there's also has to serve as a warning to people maybe listening to us, that you just can't, disclaimer, these substances are not legal, not in Italy and not in a lot of other parts in the world. It's now possible to research them, and research is actually providing us a lot of data. A lot of them are really, really interesting, but it's not legal and it's not suggested. Don't ever think that this gonna be a magic pill that's gonna solve your problem, because it's not like that. It's actually the opposite. It brings the person at center again.
Definitely.
So it's a personal responsibility. It's the matter, and also the journey that the person before taking psychedelic and also after taking psychedelics. So that's the thing that I think we need to be really, really careful to spread the word in a certain way, because we read the quotes and we say, wow.
Definitely. I mean, psychedelics are such powerful substances. I mean, these are maybe the most powerful substances that we know of that are, right? And because of this, they have such a power to disrupt your, let's say, normal thought patterns or things like that. So they have enormous potential for change and transformation. But this can go either way. So it's very important to take them in a responsible manner, in a structured setting, when you know what you're doing, with someone who ideally under the supervision of a medical professional, which now is unfortunately only possible in very few countries around the world. There are, of course, as you said, it's not a magic pill. It's not magically solving all your problems and this is the only thing you need and you don't need anything else. It's not like that. Of course, as every substance, it has its own side effect profile. It has its own pros and cons. But with responsible, a lot of these side effects can be diminished. And from a clinical point of view, from a research point of view, it really is a pity if we are not able to harness this immense power that they have and to use it to figure out how we can safely use it to benefit people. Right, but this is very different from recreational use, of course. So we definitely do not condone this.
Exactly. And recreational use is totally different matter. We are always speaking about powerful substances, the power being known for millennia in the world. You don't want to, you can have fun in different ways, not taking these powerful substances. Maybe give the right respect to these substances that they deserve. You mentioned Fediman that was saying that microdosing psychedelics could be better for cognitive performance than Adderall. You cited that before.
Safe.
Yes, safer. That introduced the discourse about stimulants in ADHD because Adderall is actually cognitive in nature drug that people use. Normal normal people use to be performing better in cognitive tasks like studying and but it's also drug. It's prescribed for ADHD people. Where maybe it's always paradoxical, not that hyperactivity be treated with a stimulant that in normal people actually hyperactivate the person. Instead, in the ADHD brain, it actually makes the opposite. That it calm it down and it slow the time and make it possible to focus more. This also been shown that could be the case with psychedelic, but how are the different effect of these two different meds?
Yeah, very good question. Very, very important topic of discussion. I think also tying to what we just said that psychedelics are not necessarily like a magic pill and we don't need anything else. And with this comparison, I also don't want to convey the idea that they are better or one is better, one is worse. But it's important to understand these similarities and differences in order to understand in what ways can we apply one or the other substance. And what we try to do is just try to add microdosing or psychedelics just as another tool in the tool set of the psychologist or the psychiatrist. Ideally, if research, we're still very much in the beginning of all of this research, but yes. So that being said, it's important, I think, to highlight the similarities and differences to have a better idea of how they differ. So here I prepared a little table summarizing all of these points, and of course I will go over them. So starting with a more biological point, we talked about this briefly, that stimulants mainly affect dopamine and norepinephrine, which are mainly at fault in ADHD people, while psychedelics can mainly affect serotonin. They don't have a direct action on dopamine and norepinephrine. However, with their action on serotonin, they do affect the levels of dopamine and norepinephrine, as we saw. So it's just a different mechanism of action. Right. The way that they are taken is also different, of course. Stimulants are taken every day, usually multiple times per day, unless it's the extended release formulation. Psychedelics are not taken every day. There are different ways of taking them, different frequencies that work for different people or different purposes. But generally, it's recommended to have at least one day in between microdosing sessions. So you don't take them every day, even probably once every few days. Again, so different type of administration. Yeah, they also have very different ways that they act on your symptoms. For instance, stimulants are very fast acting, so they start acting already 30 minutes to 60 minutes after you take it. And already after this time, very short time, you have some symptom reduction, super fast acting. and they're very effective in the short term because of this. However, with the long-term administration of stimulants, their efficacy goes down because your brain basically adapts to this. So stimulants increase dopamine, and your brain adapts to this by making itself learning how to be very good at clearing this excess dopamine. So
Okay.
in a few years of taking it, their efficacy will decrease over time. So in children, for instance, it's effective medication, but in adults, it's not so effective, especially if you have taken it as a child already.
All right.
While psychedelics have a totally different way of acting, they have a slow activation. As we said, they might have a cumulative effect, so they might necessitate a cumulative effect. So you need to take them already for maybe 1 or 2 weeks in order to feel the full benefits, start feeling the full benefits. And these effects are only, like the full effects are only seen to start working. And we saw that in the ELINE study, right? So after 2 weeks, they decrease symptoms, but after 4 weeks, they decrease symptoms even more than stimulant medication. So they needed some time for their full potential, right? Their full benefits. So again, different way of working, right? And I think the most important point that we briefly touched upon as well is that stimulants is more of a passive treatment, right? Just the traditional way of looking at treatment and medication. You take a medication, you wait for it to take effect, and then when it has effect, that fixes some issue or some symptom, like if you have pain, for instance, right? It fixes that. Whilst we touch upon this, necessitate a more active approach from the user. So you need to work with the substance. The self and the psyche component, the mind component is much more pronounced. And they also necessitate some active action from you as well. You can't just take them and wait for them to fix your life and your symptoms. You need to actually work with them. And in this sense, they don't necessarily directly fix an issue or symptom, but they might make it more easily for you to be aware of these things, to give you more control of yourself, to get into like a flow state easier, to be more in tune with yourself and be aware of your own behavior, of your own mind, of your own thoughts, of your own weaknesses and strengths, and also to make it easier for you to perhaps change these thought patterns, right? And kind of be able to teach you how to deal with your symptoms. But again, you need to take the active lead here, right? You need to already want to do these things, to be in this mindset, to be on this path towards getting better. And then they will help you a lot, right? And I think this is very well illustrated in this quote here, which it's from a survey study, and this is a quote from not from the participants, but from the authors, who, after reading a lot of the statements from their participants, kind of summarized what they thought. This is specifically for people who have ADHD who microdosed in this study for their ADHD symptoms. And they say that a key perspective in those reports of the people was that psychedelics fundamentally differ from established or prescribed psychiatric treatment in the sense that they do not mask issues or facilitate a passive coping mechanism, but instead can assist the user in recognizing the root of their problems and working through them. Right. So it kind of also showcases what I said about the more active approach, right? The mindset as well is important here in psychedelic therapy in general.
Yeah, and also in psychotherapy in general. Recognizing the root of the problems and working through them is actually one of the core aspects, one of the core way that psychotherapy works, so to raise awareness and also get in touch with your resources and your limits and actually your possibility to feel better.
Definitely, yeah.
Yeah, it could be like a psychotherapeutical aid, a really powerful one. But my opinion as a therapist is that at least the classical psychedelics, I don't know, the new ones is gonna be available in the market. Maybe the psychoplastogens that they're not providing hallucinations. Maybe they can be used in a different way. But with the classical ones, we can't say that you can be treated like a pill, like an Adderall or like a paroxetine pill that just.
Definitely. Yeah, no, definitely. And I think this is just the nature of these substances, right? And that can really work wonders if it's in the correct setting, but it can also be scary and perhaps even traumatic if it's not in the right setting, right? But talking about this, I also think that they're a perfect candidate to be like an add-on for therapy, talk therapy, right? For people with ADHD or just in general. Because, for instance, currently the primary treatment approach for adults with ADHD is pharmacological treatment plus cognitive behavioral therapy. It's always in combination with CBT. So I think microdosing might be a perfect candidate to also be in this treatment model, right? Of having microdosing and alongside that having CBT that helps you manage all that happens during microdosing, and microdosing kind of facilitating all that happens during therapy. So I think they might be work in symbiosis together.
Yeah, are you going to focus on this in your next research?
No, I will not. We won't look at therapy. We're just looking at the pharmacological treatment right now, and we're trying to establish efficacy, proven efficacy. And what we also will look at is what are some different ways of, some predict which type of people might benefit from this. So more like a biological way, not so much in the therapeutic, on the talk therapy aspect. But I'm definitely interested in this and combining microdosing with talk therapy and seeing what the results is, because I think definitely they might enhance each other.
Yes, I mean the research of this kind is going to be really precious because as we spoke about precision medicine, they can really help to tailor the treatment. And we are not going to go into the artificial intelligence augmented medicine, but we can see that precision medicine could benefit a lot with the new technologies. And why don't imagine a world in which biological treatment can get along with the same line with therapeutic, psychotherapeutic treatments, and also maybe societal changes.
Yeah, no, definitely. That's a very good point. Yeah. And we know that a lot of these disorders, psychological as well, can stem or at least have a big component that are very heavily influenced by your surroundings, your socioeconomic status, for instance, or where do you live, how much nature is there around you, or things like that, or the social connections you have with people. Of course, this is very
But this is
important
this is
for quality
general,
of life.
yes. Of course, it
Yes.
is general, but maybe the effect of psychedelics actually shown to have on people is like this increased sense of community, of connection. Maybe could also work in a higher level in the society, in the community, so that make this change also possible on those levels. And it was just really nice to talk to a researcher that it's informed, curious, and also have a point of view that span across from biological to therapeutic to experiential. No, because yeah, we also mentioned that in Netherlands, for example, it's a gray area. No, the psilocybin, and some people can actually access the substance in more or less legal ways.
Yeah, it's still
Hmm.
gray area also here. I mean, they're legal for research purposes, but again, it's very hard to get them for research. I mean, especially if we get them from outside the country, it's really, really difficult, and it takes a
Ah,
long, just the whole process of the documents and all the permits, right? Because again, they're regulated substances and they're only legal for research purposes. And also, which is a bit of a loophole here in the Netherlands, the truffles, the psilocybin truffles are legal as well, but not the mushrooms
yeah,
themselves,
that's
just the
something that
truffles.
it's funny.
Yeah,
I can say it's
I
funny.
don't get the logic, to be honest. But because of this, there's a lot of companies that sell those microdoses, truffle microdoses, and they even offer microdosing programs. So you can buy it
Ah,
from them, and then enlist in a program where you have some structure to your microdosing experience, and you have like a guide that can answer your questions and help you microdose in an appropriate way, which I think is a good approach if you would like to try it, of course. But again, in only in countries where it is legal, of course.
yes, and it's always better to try it with a proper guide, a certified guide
Definitely.
that actually know all the aspects of these substances.
And I'm really excited also to see now that there are some developments in terms of education for facilitators or guides, microdosing guides, if you would like to become one. They are training programs. They're not super accessible right now because they're still rare. They're very expensive, for instance, but they exist in the Netherlands. And also I know in the Mind Foundation in Berlin, in Germany, also there are courses on this, right? And in the Netherlands, because microdosing is, well, truffles are legal. That's why there are also a lot of this hype around microdosing. So a lot of these microdosing facilitators or coaches, you can become one of those.
That are not certified in any way. They're just
Yes,
right.
exactly,
That's the
exactly.
danger. Yeah.
Yes, that is true, definitely. But still, there is some effort to have this, make like a course or like an educational course about that. So that is still better than nothing, definitely. But we still have a long way to go. Also because it's not regulated by the government. So,
Yeah,
it's
that's
still a bit in a gray area. Any business can make up their own microdosing program, let's say. So.
exactly. So we really hope that gonna be regulated as soon as possible to give safety to the user that are around, because we can say that there are no people using in Netherlands. They can sell truffles just because they are underground and not mushroom because they're overground. But still, they are the same fruit and the same psychoactive components. So the thing it's around, and the sooner the government regulate them, the sooner we could have certified professionals, certified courses that can actually guarantee safety, efficacy, and a way of looking at these things in a serious therapeutic way and research-based way.
Yeah, this is what we're all working towards, right? This is the whole
Yeah.
purpose of doing the research, to get to a point where we can, have them in clinical practice.
Well, bring them into the society, right?
Exactly.
Bring
Yes.
them to the people who can actually benefit from that.
Exactly. Yes.
And so
Yes.
that's why your work and the work of researchers like you is of the utmost importance, because only through this we can actually, with the current system, we can actually make the steps that I just said happen. So
Yeah.
regulation, safe implementation in the
Exactly.
health system of the Netherlands, of Italy, of Germany, whatever.
Exactly. As I said, they're so powerful that it will be a pity if we don't harness this power in some way and we find a way to use this power safely, of course.
Yeah, we failed once as a Western civilization with this substance, and that failure actually brought to a stop in research for 50 years. So we actually don't want to do that again.
Definitely not. Yeah. Yeah, that's why we also have to be careful now as researchers as well, that we don't let too much hype, because people were very excited about these, which, I understand their excitement, but also as professionals, we need to keep it professional and only speak of the facts and the things that we know and don't give false hope. So I think this is also really important as well, and what we try to do also with this podcast as well.
Yeah, that's one of the main mission of a psychedelic society, like the one I belong to, and also for my personal mission is also to inform people, because also in Italy we are assisting to a rise of interest in this matter that can be dangerous. I think that what we need is also to inform mental health professional and researcher, and that's why a contribution like the one you just gave this podcast, is so precious, because to look at these components in a scientific, precise, and professional way, I think it's the best way to let these substances, but I think I say this psychedelic approach into society safely, the better chance of using them correctly for good. So thank you very much for this interview. Please keep me posted with your further works.
Thank you very much for having me again. It was really my pleasure to talk to you about this. I also hope that perhaps we can do maybe another episode in a few years, updating you on all the research that has happened in those years.